All right, guys, I hope everybody's got your tissues because this is the last slideshow of the term. But seriously, this one's all about mental health therapies. Here's a quick overview. Talking about psychoanalytical therapies, which if you remember, that's Freud, humanistic therapies, behavior therapies, cognitive therapies, biomedical therapies, and that's it. And then we're done with the fastest slideshow ever. All right, so here's therapy defined. So it is basically techniques to help people deal with psychological or interpersonal problems. It's a focus on changing behavior, and therapy approaches are related to the main theoretical perspectives and beliefs about root of behavior. And sometimes it's just darn nice to talk to someone. All right, so psychoanalytic, this is the Freud type of therapy. So this is all about looking into your unconscious and seeing what internal conflicts are driving abnormal or maladaptive behavior and resolving those conflicts. So there is the traditional psychoanalysis, which includes free association, which is just talking freely about whatever. And you don't censor your thoughts, which is awesome because we spend all day censoring our thoughts. So in free association, you just get to say whatever comes to mind, whether it's good, bad, or otherwise. Then there's dream analysis, which if you remember, Freud had several thoughts about that. But dream analysis is just talking about your dream, and then your therapist helps interpret the true meaning. Most dreams are about anxiety and loss of control, by the way. Then there's resistance therapy. So that is when you try to avoid or deny certain topics or issues. So often that reveals a truth or a conflict. If the therapist can figure out why you're resisting or what you're resisting, then it will, come out that maybe you're afraid of flying because your great-grandma was a flight attendant and she smacked you once or something like that. That's reaching, by the way. Then there's transference. So transference is when basically it's like role playing. You react to the therapist like they were a relative or a close person, and then the therapist can use this to get to the root of the conflict and hopefully resolve it. Hey, that's not Freud, that's Hannibal Lecter. So modern psychoanalysis is usually short-term, and it still is going to rely on your therapist and their interpretation of your behaviors. And it focuses more on like current issues than past issues. So if you go and talk to someone because you're depressed, you will probably spend more time talking about your current job or your current relationship than you will about every job or relationship that you've ever had. Oh, there's another Hannibal Lecter. This one's creepier. All right, that was a drum roll, by the way, for the very first index card of this slideshow, which will say psychoanalytic therapies. All right, and a round of applause. The backside says traditional psychoanalysis, free association, talk freely, be analyzed. So this is the last reminder that these Note cards don't cover everything in the book, but they do cover things on the test. So we talked about more than just free association, but if it's on the note card, chances are good it's on the test. All right, then we've got humanistic therapies. So this is when a client decides what to talk about and the therapist is just a coach to kind of help the process along. So they kind of coach by asking safe questions and doing a whole lot of how did that make you feel type of stuff. Client-centered therapy is pretty much just focused on these three things. So the first one being empathy, the ability to understand others without being judgmental. Then genuineness, which is the ability to openly share thoughts and feelings with a client. So that is like you don't put yourself, the therapist doesn't put themselves above you. You don't put yourself above therapists. You guys are partners in the process. And then there's unconditional positive regard. So that is the ability to accept and value a person for who they are, regardless of their faults or problems. Alrighty, this one is going to say humanistic therapies. And on the back side, empathy, genuineness, unconditional positive regard. Accept them for whom they are. Alrighty, then we've got behavior therapies. So, this is therapy applying classical and operant conditioning principles. So, OMG, we just came full circle. Remember the very first chapter, we learned all about classical and operant conditioning. And now here we are in the last chapter, learning more about classical and operant conditioning. Oh, it's the circle of life, people. Alrighty, so this kind of therapy has a couple of examples. One is systematic desensitization. So that is used to overcome phobias. You're desensitized to fear by using gradual baby steps and learning to relax instead of being fearful during stimulus presentation. And the irony of that is, in a couple slides, I know there's a picture of a big fat spider coming up, and I am already stressing about, like, I don't want to click the button to go to the next slide because it might be the spider slide. So, you know, good job for me. Then there's also aversion therapy. So that is pairing an unpleasant stimulus with behavior to stop the behavior. So that would be like if there was a behavior that I didn't like biting my nails, and they showed me a spider every time I was biting my nails, then maybe I would stop biting my nails because I'm terrified of spiders. All right. And then operant conditioning techniques for reward and punishment, if you guys remember that from a few chapters ago. And it's to keep a good behavior going or to make a bad behavior stop. All right, please don't be the spider next. Oh God, it's the spider next. Okay, goodbye, go away. Go away, spider. Okay. Here is another slide, maybe the last slide, maybe not. Okay, this one is behavior therapies. Oh, and on the back side, systematic desensitization. So you can overcome phobias in baby steps. All right, then we have cognitive therapies. So cognitive therapies are focused on changing bad patterns of thinking. We've got rational emotive therapy. So this says that it's not the event itself that causes problems, but the interpretation of that event that causes emotional upset. The job of the therapist is to find that irrational belief that their client holds, and then it's their job to confront and refute it, identifying its logical fallacies, and making a person validate it and pushing them to look at things in a different way. So they're using logic to fight the irrational. And then there is cognitive therapy focuses on negative thought patterns that we fall into. And cognitive distortion is distorted thinking patterns like overgeneralization or all or nothing thinking, snowballing, things like that, that usually lead us to issues. Note card time. Cognitive therapies. Any guesses to what's on the back? Challenging irrational beliefs. All right, biomedical therapies. So these are drug therapies that are used to reduce symptoms. Also surgical. Here's a nice lovely picture of a lobotomy. So that's nice and happy. Alrighty, so drug therapies used to reduce symptoms are not a cure. They're usually prescribed along with therapy, providing holistic care to the client. So if and only if these disorders are chemical imbalances, then they throw a general umbrella of that chemical to your brain and pretty much pray for the best, cross their fingers. And oftentimes it does work in the way that it will take the edge off of the symptoms, make them not so intense. But hopefully it also allows the symptoms to relax enough so that the therapy has a chance to work. There is ECT, which is basically electric shock treatment. So they used to do this in the beginning of the century probably through the 70s or 80s. It was pretty widely used, and then it became, I guess, looked down upon because it's basically torture. You're basically electrocuting someone and hoping that you don't fry their brain. However, they have made quite a few significant breakthroughs with this and have found that it works well with severe depression, manic depression, bipolar, things like that, because and they're not sure if it either shocks some neurons into working harder or if it kind of just reorganizes things. Fun fact, not so fun fact, but Carrie Fisher, who played Princess Leia in all the Star Wars movies, she loved getting electric shock therapy. She swore by it for her manic depression and her bipolar episodes, and the only problem is that she would get these treatments and then she would start losing memories. So that's actually why she started writing some of her books, is because she was trying to remember a lot of things. So she's got like the last few years of her life, she was writing a lot of memoirs because she was trying to organize her memories and write them down so she wouldn't forget them because of her electroconvulsive therapy treatments. And then there is psychosurgery. So that's going to be things like the lobotomies. Yuck. And then they also have like things that they can do, open up your brain and stimulate certain areas and hope that it will alleviate the symptoms. So so in the 50s, I don't know if you guys know a lot about lobotomies, but in like 30s, 40s, 50s, 60s, if you were depressed or if you had what's now known as ADHD, or if you had any undesirable behavior, they would just go for a lobotomy. And the lobotomy is, to tear some stuff in your frontal lobe, and oftentimes it would leave you more disabled than you started out to be. This picture, of course, is old school electric shock therapy. So see, they're putting non-conductive material in her mouth so she doesn't bite her tongue off because it causes seizures. So here's just a tiny bit more. This is like the end of the last slideshow. We've come such a long way, you guys. But they anesthetize you for ECT, and they just kind of pulse little electrical currents through your brain to trigger a seizure, to kind of get your brain to restart. I always think of it like an iPhone. Sometimes you need a hard restart, and then it works fine. It's not frozen anymore or whatever. So they used to use this for schizophrenia, and that was like their go-to treatment if somebody had hallucinations and stuff, but they found that it really doesn't work for that. It really instead works for depression. And it's usually a last resort. So now they have kind of come up with a couple of newer techniques. One is TMD, and it's all about stimulating magnets around your brain, and it's supposed to help with depression. And then you can also have kind of brain surgery, essentially, where they just touch certain areas of your brain to try to stimulate it, to kind of wake it up or slow it down or what have you. And that was it, you guys. Amazing term. Thank you so much for all your hard work, and we will be studying for the final, which will be in 2 weeks. It will start on the 23rd. So write that down in your calendars. This week you've got homework on chapters 11 through 14, and then a quiz the next week, and then the final, and then you're done. So congrats, you guys.